Right now, the Clinton giveth and the Clinton taketh away. Bill Clinton, campaign hero for the president, says Obama should change his signature law. You'll hear from the former president, and we'll talk about what this will impact the current president. Also, the 2016 battle royale, and trust me, the battle lines have been drawn. Hillary versus Christie. New numbers in what would be the biggest New York-New Jersey fight since the Rangers and Devils. Plus, new challenges in each one's path to the nomination, as well as the White House. And later, the de Blasio family dynamic. It upended the mayoral campaign and led the public advocate to Gracie Mansion with a huge landslide. But it is also the topic of an amazingly tone-deaf editorial today, one that may speak for many voters more than care to admit. Good evening, everybody, and welcome to RFL. I'm Richard French, and thanks so much for joining us this Tuesday evening, November 12th. Now, since the rollout of Obamacare happened on October 1st, the criticism, political attacks, legitimate complaints here, they have focused on two areas. The website, which provided to be dysfunctional at best, and a growing trend among health insurers dropping some customers as they drop some plans and forcing them into more expensive ones. Now, it's not happening on as wide a scale as some would lead you to believe, mostly to younger people whose new, more expensive plans often come with smaller copays and deductibles, but nonetheless, it is happening. And today, former President Bill Clinton, one of the key Obama cheerleaders in the fourth quarter of that last campaign, well, he sounded off.
For young people mostly, but not all young, who are in the individual market whose incomes are above 400% of the poverty level. They were the ones who heard the promise, if you like what you got, you can keep it. I personally believe, even if it takes a change in the law, the president should honor the commitment the federal government made to those people and let them keep what they got.
Sure, right now the president's saying, thanks a lot, Bill. Appreciate that one. And don't think President Clinton didn't know full well the impact his words would have, as the attention obviously shifted to, see, not just some Democrats, the Democrat is calling you out, Mr. President. Especially coming just days after the White House shifted tactics, the president, as many of you saw, for the first time apologizing for a very specific part of his Obamacare sales pitch.
I am sorry that they are finding themselves in this situation based on assurances they got from me. We've got to work hard to make sure that they know we hear them and that we're going to do everything we can to deal with folks who find themselves in a tough position as a consequence of this.
So what does all this mean for Obamacare? Will the rollout still work? Will they get to the deadline of November 30th? Will this finally give the GOP the upper hand? Those questions, a lot more. Let's bring in our panel on this tonight here. Brad Gersman is here. Last time we saw him, he was like a reporter out there in the field on election night, political consultant, to founding partner of Gotham Government Relations. And next to Brad, of course, Dominic Carter. He, political journalist and author. And last but not least, Andrew Whitman, senior political correspondent. And Andrew, with friends like these, I mean, do you think, let's just play this thing out here. President goes in some network never even heard of, does an interview. You think the White House is saying, are you kidding me? The president, Clinton doesn't do throwaway lines. There's a plan to everything here. And we talk about 2016, we'll do it tonight. It still is 2013. This was the last thing the administration wanted right now. You think they knew it was coming?
I'd like to think that it gave them a heads up that it was coming, but knowing Bill Clinton the way we know him, there probably wasn't one. It probably came out just like that. They do the math as well as anybody else does, and he knew full well what the headlines would be, that it would be Bill Clinton criticizes Obamacare rollout, and Bill Clinton calls for changes in the law, and you also whittle it down in some networks to Bill Clinton now against Obamacare. I don't think any of that is entirely true. But that's certainly the takeaway that's going to come from it, and Clinton knew that. So, you know, we don't do a lot of delineating the shades here in our political world these days. It's going to be interesting to see the way this spins out.
The cynic in me says, Dominic, Bill Clinton said this for one of two reasons. One, obviously, he's trying to give his wife some cover here so that there's a parting of the company where she doesn't have to say it from here in the White House. But also, he might have heard here they're going to have trouble making the November 30th numbers. And secondly, this might be something the president can give in on, President Obama could give in on and do. And it'll make the Clintons look good because they're the ones who kind of pushed this president over the edge. There's an agenda with everything that goes on in Clinton land here. I got to think it was more than him just showing up someplace here and throwing out something without it planning to stick.
Agenda with everything in the Clinton land, understatement of the year. Yes, I agreed on all points you made, but I don't see what the big deal is. I do agree with Andrew that the right will have a field day with President Clinton speaking up on this, but all he really said in a nutshell is what the president, Obama, said to begin with.
Whoa, time out. I'll let you finish, but my only point is, if the president said in the beginning, and he was willing to say, yeah, I mean what I said, he wouldn't have apologized. He said he was sorry for a reason.
Well,
he was sorry because people took it literally what he was saying and saying, you can keep your doctor, you can keep your plan, and people can't.
Right.
So,
and they should take it literally because that's what the president literally said. So all President Clinton said today was, if you have your insurance and you're changing now, you should be able to keep it. What's the big deal? I mean, everyone knows that that's the way it should be.
Big deal is the president's going to have to answer the question now and say, Bill Clinton says you should do this. Will you do the following? If he says yes, he looks like he's capitulating. If he says no, now he's even going against people in his own party.
Let's look from the Clintons' perspective and from the Democrats in general, their perspective. This has to get cleaned up. This is a major scar. This is a major mark on the Democratic Party as they run in the midterm elections and then as we move towards 2016.
But there's no way to get away from it.
Well, there is a way. The way is if there is some way to legislate what, some other, look, let's start at the beginning. With Obamacare, with any kind of major legislation of this sort, there's supposed to be additional legislation that comes into play that they start to enact when a new piece starts getting passed.
Brad.
Nothing happened. Nothing happened.
When we had a signature piece of this legislation, we never even got to the implementation point because we got the numbers here, enrollment numbers, how many people, they just came out with them today. If we can bring that up here. Enrollment in terms of this plan here, we're talking, I'm joking when I say dozens here, but nonetheless, they got less than 50,000. Some people put it closer to 40,000. They thought they'd be at 500,000 at this point. So you can debate about how to amend the legislation, how to change it. The total that they're expecting here, come December 15th is 1.4 million. They don't think they'll even get the website operational, and this is being optimistic, till the end of this month. So my point, Brad, is, hey, Republicans, they've wanted to fund the thing from the beginning, and the thing didn't even get off the ground. So, we can say they're not playing fair, but at the same time, the administration made it easy for them.
No, this is a disaster. Let's not mince words here. This is a disaster for the president. It's a disaster for the country because I think it was a great idea, and I think there's still opportunity here. But there has to be a plan B, okay? Because if you don't get the enrollment, somebody must have made a plan for what if this doesn't occur.
Who thinks they have a plan B if they couldn't even get the website to work?
Well, that's the point. Is if we can't get the website to work, you start losing faith in the government and our president. But he's put himself in a tough situation. Hence, the fact that Bill Clinton comes in and makes a statement that everybody would agree with. Come on, he just came right down the middle here with a Mack truck and said everyone should be able to keep their insurance. Well, that was what the plan was. Some reason that wasn't what it turned into in implementation.
Interestingly, I think the White House has the wiggle room to extend open enrollment and delay that part of it, give people more time to enroll and delay the start of coverage. They might not have the wiggle room to make the changes that Bill Clinton was talking about.
Yeah.
That may have to go back before Congress, and I don't have any confidence that they can get any changes, positive or negative, well, negative maybe, to Obamacare past Congress. Because
that's what the problem is.
Right. Anytime they bring up a bill that says we're going to do this one little tweak to Obamacare, the Republicans are going to be like, I'd like to amend that bill to say to fund the whole thing.
See, I think there's a bigger problem. More than the website not working, their math isn't working in this. The whole idea was, we're going to provide an across-the-board affordable option. I thought the far right, for the last 5 years, has made up their numbers as they've gone along on so many things. They're creating panic and fear out of complete thin air. But on this particular one, they can say, time out. I got Brad over here. Brad, tell him your story. How much were you paying? How much are you paying now? And the math doesn't add up. Now, they may be isolated.
It is primarily young people.
But they need the healthy young people to sign up, or else it doesn't work.
I understand. But young people, healthy people are a pretty small minority of the people who are overall going to get insurance in the country.
This doesn't work.
I understand that.
So if you don't get them, and they're not getting them now, and they're the ones that are finding that it may not be a better, affordable, short-term answer for them, how does the thing work? And then what happens? That's my question. What happens at the end of December if they don't get the math?
But the clock doesn't really start until the system is up and running. So all the old estimates, that's all out the window now. You can't count those numbers.
They can't wait, Dominic, until spring to say the numbers will come, the numbers will come. Because
Right,
you think we got
that's
a
true.
problem now. Forget about, let's say they make the site operational and there's legitimate skepticism that says November 30 will work. Now all of a sudden we get in the middle of December. They keep coming way off these numbers, and more people are skeptical and don't want to necessarily do it. Then what happens if they don't meet the threshold that they set for themselves for spring?
Two things. One, yeah, the system can run at a deficit for a year while they don't have the numbers that supports it, while more people come through it. That will look bad, but it can still function. It's not like the whole thing absolutely falls apart. It just would run off deficits. And the second part is keep in mind, anytime you have a program like this, or when this program was rolled out in Massachusetts under Mitt Romney, people signed up at the last minute. People realized that there's a penalty, that they're in trouble if they don't do it.
They didn't have the scope of the rollout
I
problems that they had
understand.
with this one.
I understand, but Medicare Part D, they had rollout problems also.
It's the nature of
don't
people.
bury it yet.
It's the nature of people to wait to the last minute. I agree, and there may be more time in this startup where it will cost us more money to maintain this program. In the meantime, again, I do think 5, 6, 7 years down the road, we'll be happy that we have this, and it will reduce healthcare costs. I'm a true believer of that.
The problem is, you
because
said
the
it
math-
yourself, Brad, that's
but
not
it's a
the days
problem.
we have to work, because Democrats, they have a chance. They saw what happened after the shutdown. They saw the brass ring that they could actually take back the House in the midterms with the math they saw, and now they say, wait a minute. People are going to remember this more than going to remember the shutdown here when they go to the polls next year. We're in trouble here, and they're going to stay on the ship too long before they bail. We know that. Now, the messy rollout of Obamacare, the subject of our online question tonight. Do you think they're going to get their act together and they'll straighten out Obamacare when they need to? And again, key dates here, end of November when the administration says the website will be fixed, and as Andrew said, December 15th, the next deadline. So, what do you have to say? Does this stuff get turned around? And if so, when? Head over to RFL for our Facebook and Twitter pages to sound off. Up next here, we will turn, speaking of the Clintons, on the RFL Hillary machine here. She is the overwhelming frontrunner, at least on paper, and has been clearing the field for her 2016 run. Don't believe the hype here that she's not made up her mind yet. Come on. But the question is, will the progressive left play along here? We're going to be back with that after this.